Bismillahirrahmanirrahim. Assalamu alaikum. I am Dr. Mujahid Buneri. Welcome to the channel Dr. Mujahid Buneri. I hope you are doing well. Do you know over 1.2 million cases of bacterial meningitis are estimated to occur worldwide each year? Only in the year 2015, 379,000 people died due to meningitis worldwide. Today, I would like to discuss about this killer disease. You will have a full hold on all the aspects of acute pyogenic meningitis after watching this short video lecture, inshallah. At the completion of my lecture, I would like my students to have complete knowledge about 1. What is acute pyogenic meningitis? 2. What are the causes of acute pyogenic meningitis? 3. What are the clinical features of acute pyogenic meningitis? 4. How will you diagnose acute pyogenic meningitis? 5. How will you treat acute pyogenic meningitis? 6. What are the possible complications of acute pyogenic meningitis if left untreated? Okay, let's begin. What is acute pyogenic meningitis? Acute bacterial inflammation of leptomeninges and cerebrospinal fluid within subarachnoid space is called acute pyogenic meningitis. What is meant by leptomeninges? These are the two connective tissue layers around central nervous system, namely arachnoid matter and the pia mater. If inflammation occurs to the third and outermost connective tissue layer of central nervous system, which is dura mater, that type of inflammation is called Pachy meningitis. I hope the difference between meningitis and Pachy meningitis is clear now. Moving on to the etiologies of acute pyogenic meningitis. Overall, the most common cause of acute pyogenic meningitis is Streptococcus pneumonia. Multiple choice question. In neonates, most common causative agents are E. coli and group B streptococci, such as Streptococcus agalacti. Multiple choice question. In adults, most commonly it is caused by Neisseria meningitidis followed by Streptococcus pneumonia. Another multiple choice question. In elderly people, most commonly acute pyogenic meningitis is caused by Streptococcus pneumonia and Listeria monocytogenes. Multiple choice question. In past, Haemophilus influenza was the most common cause of meningitis in children, but this has markedly decreased with the Haemophilus type B vaccine. Okay. Coming to the clinical features. Regardless of microbiological etiology, acute pyogenic meningitis present with high-grade fever, headache, photophobia, neck stiffness, positive Kernick sign, and positive Brudzinski sign, as well as nausea and vomiting. Altered mental status is possible as well and can make a patient seem like they have encephalitis. Any form of central nervous system infection can present with seizures. Focal neurological deficit can occur, the most common being visual field and cranial nerve deficits. Multiple choice question. The most common long-term neurologic deficit is damage to the 8th cranial nerve. Point to be noted. Okay. How will you manage the patient? First, take detailed history. Number two, do relevant examination, including general physical examination and neurological examination. Number three, advise relevant investigations. Number four, treatment. Investigations include 1. Blood culture before starting antibiotics. 2. Lumbar puncture. Lumbar puncture is the best initial and most accurate test for establishing the diagnosis. Multiple choice question. 3. CT scan of head is the best initial diagnostic test if the patient has papilledema, focal neurological deficit, altered mental status, or seizures. If lumbar puncture is delayed more than 20 to 30 minutes for any reason, then the best initial step is to give an empiric dose of antibiotics with ceftriaxone or cefotaxime, meaning third generation cephalosporin. Additional investigations in acute pyogenic meningitis include complete blood count, blood sugar level, serum electrolytes, renal function tests, and liver function tests. Okay. What will be the CSF finding in acute pyogenic meningitis on CSF routine examination? Cell count will be increased and predominant cells are neutrophils. Protein level is elevated. Glucose level is reduced. Gram staining is positive in 50 to 70% cases. Multiple choice question. Culture is positive in 90% cases. Multiple choice question. Coming to the treatment. How will you treat the patient? Treatment includes supportive treatment and specific treatment. In supportive treatment, you will give 1. Antipyretics and cold sponging for fever. 2. Intravenous fluids. 3. Feeding. 4. Bowel care. 5. Prevention of seizures by giving benzodiazepine. In specific treatment, the best initial treatment for acute pyogenic meningitis is intravenous antibiotics like ceftriaxone and vancomycin, and then change according to the culture and sensitivity report. 2. Give intravenous corticosteroids. 3. Proper analgesics. 4. Management of raised intracranial pressure. 5. Management of complications. Okay, moving on to complications of acute pyogenic meningitis. It includes number 1, deafness due to the cranial nerve aid palsy. It is the most common complication. I already told this. 2. Cerebral edema. 3. Hydrocephalus. 4. Ventriculitis, meaning inflammation of ventricle within brain. 5. Hyponatremia. To wind up today's lecture, I would like to ask 3 questions. You can write your answers in the comment section box. 1. What is Karnik sign? 2. What is Brudzinski sign? 3. What is the recommended time to advise test for group B streptococci in pregnant women? This was all about today's lecture. Thanks for watching.